So I'm happy to start. Graeme, did you want to introduce everybody, or just
Sure.
to get things started?
Yep, no, happy to do that. So thank you to Stacy for organizing this. The goal was to provide support to primarily new investigators in terms of writing grants, and specifically it's related to the CMO Innovation Fund. But the discussion today is applicable to any grant opportunity. Stacy, can you advance the slides? So just a bit of background of the Innovation Fund process. So there had been some concerns raised over the last number of years that perhaps it wasn't as thorough, it wasn't perhaps as transparent as it could be. So we undertook a review of the process a year ago, and basically the decision was to make it more like a CIHR type panel. So there's 2 reviewers for each grant, there's 2 readers for each grant, and there was a committee that involved all the applicants. All the applicants were broken into 2 groups. There was the new investigators, and then there were kind of established investigators. And so the established investigators did participate in the new investigators kind of review, and the new investigators had an opportunity to participate in the established review. And I think that with the feedback that we've received and the feedback that we provided to the investigators, whether you were successful or not, I think people found that the process was fair. They appreciated getting the reviews, which we had not previously provided to investigators. And I think it's a process going forward that is entirely transparent and fair. So I think we had quite a successful competition. Certainly there were excellent grants that did not get funded. That's a nature, unfortunately, of applying for grants. But for the most part, I think we're all happy with how this worked. Sorry, Stacey, can you just go back to the agenda? So why and when to write a grant. We're going to go through step-by-step approach to writing, some budgetary tips, general advice, and acknowledgements. And involved in this today, Genevieve Digby and Neil Renwick, they were kind of voluntold to be involved with this because they had the highest ranking grant in the review process, so they kindly agreed to participate. And Ian Gilron is also involved. Ian has put on a grant writing workshop for the CIP program for a number of years, and we've kind of stolen from his slides quite a bit, but he's there to add some color commentary as I have. Just go back to the agenda again. Yeah, and then there'll be some general advice. There'll be time for asking questions, acknowledgements. Okay, slide 3, yeah. So the objective of today's session, at the end of the session, participants will have a step-by-step understanding of how to write a competitive grant application for the CMO Academic Health Science Center's AFP Innovation Fund competition. But as I said, this is applicable to other grant competitions. Expectation is that participants will submit a highly competitive Innovation Fund application, either as an early career researcher or an established researcher in the next round. We've gone through that.
Maybe we should hand over to Genevieve.
Yes. Yeah. You guys carry on. Thank you.
Thanks, Dr. Smith, and thanks for the introduction. So in the next 20 minutes or so, Dr. Renwick and I are going to kind of go through the process of applying for a grant, specifically with a focus for the Innovation Fund and what's unique about it and how you might approach it. So we're hoping that this will set you up for success, whether you're an early career researcher or an established researcher. In terms of just general strategies about grant writing. So why might you want to write a grant, and specifically, why might you want to get involved with the Innovation Fund and submit an application there? It may be that you have a really great idea to share with the world. Maybe you have a new innovative technology that you want to tied to clinical needs that ties to this specific grant. We find that it can be kind of fun and educational to get involved in the grant writing process. It can really help you hone in on what your expertise is around your ideas, what's unique about them, that you can delve into the literature a little bit more and really figure out how your idea might integrate itself best with innovative technologies or just add something to the scientific field. Maybe it's time for you to collaborate with some new people. You want to extend your wings a little bit and take on a new focus or a new area to approach your research from. And perhaps you're on track for a research track for academic promotion, and you need to get some grants to get your research going. Now, if you're going to embark on a grant writing process, we suggest that you do that when you have enough time. And so this isn't something that you can do just a week or two in advance. It's really important to plan this out several weeks, if not a few months in advance, to work with your collaborators, to develop your idea, and to really have time to sit with it and understand how it's going to tie to the grant objectives as best as possible. We put on here that you might want to do it as an early career investigator to get your research program up and going, but you may also want to do this as an established researcher if you're looking to expand your collaborative activities. So if you're looking to kind of create, again, those links with other research groups or laboratories that you want to bring into your team. And it's also a really great opportunity to work on clearly outlining your research plan and ideas. It's amazing how much when you need to put it down on paper for a grant that it evolves and that you have to define what it is you want to focus on. And it does both make you focus and be clear about what your objectives are. So that's what we suggest, is to just getting started with the grant process. Now, on the next slide, we're going to talk specifically about the Innovation Fund. So with this fund, it's important that you adopt a translational research mindset. So the components of the innovative translational research project is one that clearly articulates a health need. So you need to be really clear about what the gap in care is that you're trying to solve. And then you have that description of the innovation. And here we're quite clear that the innovation, for it to really to make sense with this particular grant too, it really needs to be new and substantive departure that addresses a relevant innovation fund problem. So to give you an example, I do a lot of quality improvement research, and so some of my other grant approaches have been to identify what the problem is from a quality improvement perspective, and the solution, which may have been tried before or may have been successful elsewhere. But with the Innovation Fund, it's important that you take that lens of what is new and substantially different about this, that's going to change the way that you go about your research, that we might look at this disease down the road, or that we might treat this condition. So it's really important for this grant to have that focus. And then you need to be really clear from a translational research perspective on how this innovation is going to help you reach your goal of articulating the health need, and how you're going to measure the impact on the clinical outcomes and on the health needs, for it all to tie together. So Sybil, if you could take us to the next slide. Once you've decided that you think it's time to write a grant and that you need some funds and you've got a team, we suggest starting by just really getting into the weeds of the read of the application instructions. So you really need to be clear about what the application says, what the timelines are, outlining how you're going to approach the timelines, how much money can you get, and will that be sufficient for the project that you are applying for, and how will you use these funds perhaps to build your project, but being quite clear about what the duration of funds are, what the amount is, and be clear on the instructions. And we suggest that you read the reviewer instructions if they're available, or at least get a really good idea of what the target audience for the grant is. Try and get into the reviewer's mindset. What will help get your application funded? Who are they targeting? If they're targeting collaborative research, do you have a collaborative team? If they're targeting kind of early career, do you have either the people in your team that are still early career investigators, or do you have, again, if you're established career investigator, do you have that new approach or that new perspective that you're going to take to the work? And then just start to write, scribble down ideas. I like Post-it notes to jot down what my my research questions are, what the clinical care gaps are. I think Neil likes napkins and coasters or whatever else he can write on. But it's really whatever it is that's just going to jot down some ideas on paper. And I think from there, you can start to make the grant around those few notes that you've identified. And Dr. Renwick has a lot of experience writing really good grants. So I'm going to hand over things to him for how you get into the nuts and bolts of the grant itself.
Okay, so thank you very much. I think I just want to highlight that point about articulating a clinical need. I am never going to articulate a clinical need as clearly as Genevieve. And so it really is important to partner and partner very carefully. I'm going to go down into the weeds of the grant now. And what I would suggest is you reread the instructions and you note the required sections that you need to write. That this grant sort of looks like it should be easy enough to write, but it isn't. There's some sort of traps all the way through. So the sections that you need to know about are the project summary, which has a title and the project leads. There's a section for patents, titles, and commercial ownership. And there you have to talk about patentability and conflict of interest of your innovation. The plain language abstract is absolutely deceptive in my book. You sort of expect to write a paragraph, and it has tons of different little sections. So there's a project description, innovation and research question on hypothesis, the impacts on the healthcare system or patient care, knowledge translation, project duration, and funding details. There's project keywords, which they will give you a list, and you go through and look for those keywords. They're probably helpful for the people who are actually reviewing, because they need to collect all the data about what sort of innovations they're funding. But it's also helpful for you to know that you're kind of within the Innovation Fund framework. And then there's the project narrative proposal. So this comprises the background, objectives, significance, innovation justification, team, and approach and work plan. And that approach and work plan is highlighted in red for a specific reason, because in our experience, and I think a number of people would agree on this call, this is really where you start the grant. So even though it's sort of buried in the middle or towards the end, this is absolutely the place to start, because it's the approach and work plan that's the core of it. And then you kind of build everything else in the grant around it. It's really important to know the sections, because then you can create a writing schedule. This is just really for your sort of psychological benefit. You'll figure out how much time you need to write. And especially as busy clinicians, you've got to carve out time. And so it just keeps you on track if you've got a writing schedule. As you get more experience, the schedule kind of falls by the wayside a little bit. But right at the beginning, it's really important to have a schedule. You start with the approach and work plan. And then as you're reading the instructions, it's good to note some of the formatting issues, the character counts with spacing, and I'll go into that more. When we write in Word to start with, and then we copy the sections over into the form. That form can be kind of dire, actually, and writing directly in there and trying to get the formatting right, it can be very frustrating, and you can see my hair is the result of some of this. So it's really good to go back to the Word document. So next slide. Okay, so let's talk about writing the approach and work plan. There's many ways that you can do this. This is the format that we used. So we start this section going over the objective, the rationale, and the preliminary data. So the objective, given that this is either a 1 or 2 year grant, you might just be on a single objective. Usually like a 5-year grant, you would have 3 objectives, but for something smaller, you'd probably have less. You add your rationale, the reason why you're doing this grant, and you add some preliminary data. And this should be as kind of knock their socks off data as you possibly can. What would you include? For me, I often put either the rate limiting step of the project. So the part that's the most technically difficult, I demonstrate that I can do it. Or else you get to the end point and you show that there's some really great data that's there, just ready to be expanded. And that's what Genevieve and I did. So then you go into the experimental plan. This looks like a paragraph. You orient the reviewer at the beginning. So you give a little brief description of what you're going to do in the experiments. You can talk about the ethics status at the beginning. This shows that you've thought about it, and it's a place where you can say you've actually got it, or you're pretty close to getting ethics. That puts you competitively a little bit higher than people who don't have the ethics in place or haven't even mentioned it. Then you outline the main study components. And I have to say, over the years, I've actually kept a list of the main study components. So I have a bit of a cheat sheet that I use. The other option is to look in the literature. So for instance, if we're looking at biomarkers, there is actually some guidelines, published guidelines on what a good biomarker looks like. So when you're writing your experimental plan, you should make sure that all of those issues are actually covered, or they're covered somewhere else in the grant. Lastly, I think it's really important, you describe how you analyze your data, but then you should also describe how you interpret the data. And that's really helpful for the reviewer as well. So if you finish on the analysis, I think it's not quite enough. You need to just go that little bit further and really help the reviewer. You should write out your expected outcomes. It might be a few sentences. And then you should look at, mention potential pitfalls and alternative strategies. And here it's like, what if part of the grant falls apart? Or what if, you know, the whole grant just collapses? Is there some way that you can get around this? And it's still very exciting no matter what. So it's good to mention that. When you finish the approach and the work plan, I think it's good just to bullet point out your timeline, the team, the budget, and the project evaluation metrics. Because when you do that, it might actually change. You might go back and change what you wrote in the approach and work plan. You don't want to write too much. And so, you know, if funding is a big issue, you want to make sure that it's realistic. The other thing that I've realized over the years is that you don't want to propose so much that when the next grant opportunity comes down the pipeline, you can't really apply for it because you've kind of oversold the current grant that you're on. So I think it's really good at this stage just to really think about what you want to put in the approach and work plan. If it doesn't quite fit, or if it's too much, put it somewhere else. Just put it on the side and write another grant. But just don't sort of cut the legs out from underneath yourself. Okay, next slide. Okay, so once you've done the work plan, then you can go back and finish the narrative proposal section. So this has a background. I think for descriptive research, often you can get away with 2 paragraphs, you know, 2 pretty in-depth paragraphs. One would be maybe the clinical topic. This and the knowledge gap and the unmet need is usually the last sentence of that paragraph. This is where Genevieve's work was just phenomenal, because this is something I couldn't do. The writing was excellent. The needs were clearly articulated. It was sort of easy to put this into a paragraph. And then there's another paragraph about the innovation topic. And so for us, we were talking about plasma extracellular RNA sequencing for diagnosing lung cancers early. I mean, you show what is currently possible and what could be possible. I think our grant, in a way, was quite simple. So we talked about the need for lung cancer better lung cancer diagnostics and earlier diagnosis. And then we talked about what could be done with plasma extracellular microRNA sequencing. And when you put it together, what could actually be done? So the objective, you would list out what is the goal of your research, rationale, why you're doing this research. For us, it was like earlier diagnosis and then earlier treatment, better outcomes. Significance. So when you write a significance paragraph, it usually has 3 sections. So you start with a literature-based discussion of the problem and what your contribution is going to be with your research. Then the next part is you go into a significance statement. And often it's something like, our research is significant because. That has to be a killer sentence. This is really the key sentence of the whole grant. Why is your research significant? And so that's where you can wow the reviewer. And then the last part is what successful implementation of the innovation will lead to. And so very important, very formulaic. This is where you can bring in key literature just to set up the whole topic. It's the same with the innovation justification. It also has 3 sections that you can use. Now, there's other ways to write this, but this is for people who are just starting. So again, you would have a literature-based discussion of the innovation. Your innovation statement, our research is innovative because, and then you would talk about what's successful and what the innovation will lead to. So sometimes people get a bit confused about the difference between the innovation and the significance. So the innovation leads to, you know, maybe like a easier diagnosis or something. So it's a little bit more local or a little bit more proximal to the innovation. In significance, it's kind of the bigger picture. So, you know, what does this all lead to in the grand scheme of things? Whatever you decide to write, it should be different for the innovation than the significance. If you find that you're repeating yourself, you probably went down the wrong track, and you have to rewrite that section a little bit. Anyway, so this slide, you finished the project narrative proposal section. Okay, next slide. Then you go into this write the plain language abstract section, and this is way bigger than you sort of think and hope. And you can lose a fair chunk of time on this. So you write a lay overview of the project. You do this when you've kind of completed the project narrative. And it's really, really important to use lay language. And that's for a few reasons. So lay language, it makes it clearer for everybody, including the reviewer. And so often when I'm reviewing, I will go to a lay language section and just check. It also shows that you're respectful for the layperson who may be on the other end of this reading it. So when I see somebody who's just copied and pasted the science, it looks like they don't care to me. And it looks like they don't care about the patient on the other end. So it's really, really important to use lay language. The significance and innovation should also be in lay terms because there are, members of the general public who read these things. You should describe your main question or hypothesis. I would keep this very, very simple. So the longer the sentence is, the more convoluted, the more confusing. So try and just get to the core of what you're proposing. You can describe the influence on the healthcare system and also on patient care. This is where, as an autopsy pathologist, I'm almost useless. And also, I'm not from Canada, so I'm also clueless. And it's very good to have a partner like Genevieve who knows the system extraordinarily well and then can add in or actually take over this section. And same with knowledge translation. In my field, it's usually about publication or presentation. But clinically, I think you guys do a lot more. So that, there's committee reports and there's guidelines and there's social media announcements and there's, you deposit your data. And I think we kind of forget about this. So producing high quality data that gets put into into some sort of repository somewhere, that's actually a big deal. And that's part of knowledge translation. There's some really, really good resources that I'll list at the end from CIHR about the number of ways you can get into knowledge translation and sort of get your knowledge out there. So it's more than just publication and presentation. And then note, each of these sections has 1,250 characters with spaces. And again, we tend to do this in a Word document. It becomes kind of easy to do the word count. It's easy to edit. And so I would write that first in the Word document and then shove it over into the main document. Next slide. Okay, so if this is applicable, you write the patents, titles, and commercial ownership section. And you should describe your existing or your potential patentability. And you should describe mitigation of conflict of interest in case people are actually involved in patents or about to patent, because you don't want to kind of ruin your patent in any shape or form. If you're patenting, you kind of know what the issues are. What I would say is that it's really strong independent evidence of innovation. So this can look really, really good. And this is an innovation fund. you will be reviewed by reviewers, but actually a patent office, because there's money involved, will go into depth into your innovation, and they'll give you some brutal, honest feedback about why your patent isn't original. So, so if you manage to get past the reviewers in some shape or form, or past the patent office and technology transfer office in some shape or form, that's really, really good. And I kind of keep an eye out for that as a reviewer. Okay, next slide. Then you go in, I mean, you've done the hard work now, so you go in and finish the remaining sections. The title is important. For me, it should be short and catchy. I think our first attempts at this maybe were kind of long and a little dull. And I remember Genevieve saying triage, and I don't know if that's her French background and a fancy French word that she was using. I was doing molecular, and then we just put it together and wrote molecular triage, and it actually sounded kind of cool. So so there are words that you can put together. So you can put your clinical word or whatever you're doing clinically together with translational, molecular, or computational, and that can be kind of a good way to start your title. Your project leads, it's a good opportunity to demonstrate your interdisciplinarity. So I'm a pathologist, Genevieve is a respirologist. I think we both assumed, this is kind of the funny part, we both assumed that the other person would be the project lead. So we were working with each other and just doing it. And it wasn't really a conversation that we had. How this sort of came to fruition was I was the last person to have the document. And I just thought, I think the clinical need was really the more important part. So I stuck her as project lead. I went co-lead. My ego was fine. It doesn't bother me at all. And Genevieve didn't know. And it was kind of funny to see the look of surprise in her face, but it's great, actually. This is a very clinically driven project where you have, you've got to be able to articulate the clinical need. And so that worked out very nicely. And it was just a really, really great example of interdisciplinarity for me. If you have medical, parental, or maternity leaves, it's really important to note those down. Don't think of this as, I'm a wimp, I have to write, I don't want to write here. You should absolutely include it. It's really important. The reviewers are on your side, and they want to see if there's been any issues. So it's important to bring them up. If there's an information technology component, you should discuss it. That does become important when you have like maybe some big computational projects or something like that that's run through the hospital. Keywords, you select the relevant keywords. The team, this is where you can show all the relevant expertise. You add references to their expertise. This was very easy in our case. You bring in expert collaborators, which we did. We brought in a guy from Rockefeller University in New York who's sort of lurking in the background and will help us with plasma extracellular RNA sequencing if needed. And use your letters of support strategically. You've only got so much space in the grants that sometimes there's stuff that you want to mention, but you can't quite fit it in. But you can put it in other places in the grants, and a letter of support is actually a good place to put it. Timeline, it's good to put in either a graphical or a narrative timeline at least. If people don't put in a timeline, then it looks like they haven't really thought through the grant and the feasibility of it, so that you can get dinged on that if you don't include it. There's program outcome evaluation metrics. So you could, we talked about anticipated outcomes, successes, expected benefits, and IFPOC metrics, and I think it was 2,000 characters or something. So you just divide equally. And you do need to talk about additional project funding. It's okay if your project's partially funded. I just learned this from Graeme and Ian, actually. It's kind of, that is seen as a good thing. You just want to be careful of overlaps. So, because if it looks too similar, or if it is actually similar to something else that you're doing, you'll lose the grant, even though it was beautifully written and it's an excellent idea. If it's already funded, then why would you double fund? And that goes back to the point about it's really important not to overshoot, because then you might impact your next grant. Okay, next slide. In terms of budget, I find that budget, people kind of blow this off, and they really shouldn't, because your budget says a lot about you. So you should showcase that you're meticulous and that you're aware of the costs of what you're proposing. That's really important. I personally, this is a personal thing, but I'm aware of anything that consumes greater than 50% of the budget. You know, so there's been certain grants that I've looked at where, you know, 90% might be on personnel cost, a person, or 90% might be on travel or something like that. And it doesn't get into the costs of the projects, and then they're sort of not explained away anywhere else. So I think it really is important. It doesn't have to be super detailed, but it's just got to be a sort of decent overview of your budget and what you're going to do with it. Yeah, I wouldn't blow this section off. You ask your colleagues about costs and sort of get quotes where you can. It is important. On our grant, I was absolutely shocked because the reviewer was amazing. He or she or whoever went in, you know, and commented on the budget and saw something that we'd written and didn't bring it to task, but just sort of brought it up as an issue, which we had sort of considered elsewhere. And then you should mention other resources contributing to the project. So any other funding, or maybe there's some in-kind support from somewhere. So that this is also good because it looks like other people are already interested in your project, right? So that does no harm. Okay, next slide. There is a lot of psychology in grant writing, and it's sort of tough right at the beginning, and you get a bit more experience as you do more. It's important to be in the right mindset. And so we're just going to talk about mindset and advice. So first thing, you got to get in the right mindset. If you're doing it well, it's writing a grant is a creative, fun, and challenging process. And actually, you'll find that experienced grant writers really, really enjoy it, actually. It's a bit different from writing a paper because there's more imagination involved. So it is a bit more fun. It's not as sort of restricted as writing a manuscript. I know at the beginning, just because I was trying to get my research career off the ground, I was pretty tense about it. And I think it really came through in the writing as well. It certainly came through in my reactions to the rejections. So, so just try and get yourself into a good headspace. Plan very carefully. You want to make time. These things do take time. You want to factor in interruptions and life. And so do give yourself, you know, a couple of months or something like that. Yes, you can write these things in a week. It can be a very unpleasant week. So it's kind of nicer and more fun if you give yourself a bit more time. Follow the instructions and also approach it at the end like a legal brief. There are so many pieces to this grant, and sometimes you need to puzzle it. There's something that doesn't quite fit here, but it might fit somewhere else. It could be a letter of support or another section or the budget, you know. And just use those creatively so that you get everything that you want to say can actually fit into the grant. Put your best foot forward. You know, don't provide reviewers with any ammunition to ding you. So they're looking, you're in tight competition. And so people are looking for just the slightest difference. And that can really be the difference between success and failure, actually. So basically the advice is don't screw up. I mean, don't say try or hope or whatever. You know, you're doing this thing and it's going to be amazing. Write well. So this is something that I teach my students, actually. So apparently there are scientific studies that there are optimal sentence lengths, and they're usually about 18 to 22 words. I find if somebody's gone over into like 40 words, they probably should have broken it up into 2 sentences. It just makes it easier to read for the reviewer. Make sure your paragraphs are good. So you know, have a good topic sentence introducing what's going on in the paragraph, a good conclusion sentence, you know, how you conclude that paragraph and how you link into the next paragraph. Proofread. I actually do go and proofread. I proofread out loud with a ruler and a red pen. You know, that's been working well for me. And then get early feedback from colleagues. So Genevieve and I went backwards and forwards on this. and picked up stuff, and stuff that you get a little word blind and it can be hard to see. So it's good to have another person to work with. You should celebrate. It's really important to celebrate just submitting. Who cares if it's successful or not? The main thing is that you actually did something and you got it out there and you got it in on time. That it's really important to celebrate that component. The success or non-success, yeah, I mean, you can, but I basically just celebrate submission, which is good, because there's nothing really writing other than you did it. Ask for help. So there are a lot of really phenomenal writers on campus, grant writers. You have Graeme and Ian here. Genevieve and I did a good job on this one. There's other people in each department. So feel free, and they'll be thrilled to help out, I think. But everyone loves to be able to showcase their expertise. If you get rejected, this is part of the course, this happens. My role is basically sulk for 24 hours, that's absolutely fine. But then give it away, move on with your life. There's other things to do. Come back after 24 hours or even a week. Just look at the comments. I know I have a voice in my head when I read stuff. And so when I read it immediately, and it's an extraordinarily negative voice. And I think it's like a German pathologist going. And I don't know who that is. I do know who that is. And so just put stuff down and then come back to it when you're kind of calmer. And then just view it as an opportunity to improve, and they will improve. So realize that grant writing is a skill to be developed. It does take many, many grants. I got to say my initial ones were terrible, and now I see why they were rejected. We've got kind of better and better each year. There's still room for improvement. I would imagine by the time I retire, I'll still be taking grant writing courses just to make sure I'm, up to speed. You should know that the reviewers are mostly on your side. I have to say, I was pretty paranoid when I first started. I just thought, oh, what are they doing? This is like, it's a personal attack. Didn't they get it? And actually, they probably didn't get it in a way because I wasn't very clear, or I wrote something, horribly technical, and I wasn't writing for this particular grant competition. Having been involved in a number of review committees, not just here, but in other review committees, I'd say at least 99% of people on the review committees, they want to help. So they're going to review very carefully. They're going to give you great advice. You may not get the grant, but they'll give you advice that will get you going for the next one. So I over the years, I've become more and more impressed. Weird things can happen on a review committee. You can get a low and a high score, and then it ends up in the medium, and then you get rejected. I mean, that can happen, and it can happen with good reasons. Like somebody is focusing on one thing, somebody's focusing on the other. They weight them differently. There's nothing mean involved. It's just people's interpretations. I was on a grant review recently where that happened. Both were excellent comments, but it just ended up kind of mid-rank, this grant. And then remember, your great research isn't always funded, and so be persistent. If you feel like you've got a story to tell, just keep going and tell it. Next slide. So this is the last slide, just to acknowledge a few people and also to talk about some resources. So that whole thing about translational research, articulating the needs, innovation, and then describing how you roll it out, that comes from my old physician-in-chief, Barry Collar. There is a document for knowledge translation from CIHR. It's document 45321 for people who are interested. You can type that into the web and you'll get that document. It's quite a comprehensive guide to knowledge translation. Huge thanks to Ian Gilron. We got a slide deck from him, and they're phenomenal. I think we're going to circulate them to everybody that's on this. They're well worth a read. There's lots of really great information. We learned new stuff as we were reading through too. So I can highly recommend those. And then pick up a grant writing book. I've been using this Robertson, Russell and Morrison, which is great for NIH grants. It really gets into the weeds for NIH grants. But it may not be so helpful here, but just pick up a grant writing book. It's well worth the money. You'll appreciate it. So thank you very much for your time and attention, and we'll head on to the next slide and just take any questions, and feel free to fire them to anyone in the audience.
Yeah, before we take any questions, just like to thank Neil and Genevieve, and again, Stacy, for organizing. I would agree that you have to have thick skin to be a researcher. You know, I actually, like as Neil said, I actually like writing grants because it helps me to kind of focus my thoughts and, you know, putting them all down on paper. You know, you take a fixed period of time to actually to achieve that. So it is disappointing when you don't get funded. And then when you read the reviews, you know, it's sometimes even more frustrating. But as Neil said, you know, a lot of times it's because you didn't do a good enough job in explaining it to them, and so they didn't get it. And so, you know, be frustrated for a short period of time and then move on, because you have to have thick skin. The grant will only get better. Ian, did you want to have any comments?
Yeah, first of all, Genevieve and Neil, thank you very much. That was really excellent, comprehensive, and I think very effective to do what you aim to do. Just a couple one general comment about mindset that I think is great. And Neil, when you said that the reviewers are on your side is bang on. I don't know, one grant writing workshop I went to that was very compelling was knowing that there's a group of people around the table, is that to write your grant in such a way that your first and second reviewers are your champion, and to somehow express things, and you've got a first and second reviewer who may well not be from your discipline, and how do you get them to argue around the table for your grant and why that should be funded? So that's just kind of, you know, I don't know how that translates into writing, but that's just sort of a thought process. I really like everything that you said about the size and the ambition of the grant. And I'm just going to echo that a little bit, just because, you know, the CMO innovation the amount of that budget may not be huge enough to do some of the things that one wants to do. And so, you know, I think if you've got other funding sources or any in-kind contributions, and you've got a project that, I don't know, maybe it costs double what you can get from CMO Innovation, and you write it in that way, but you show that, you know, you really can get the additional funding necessary, then people, as you said, you know, see that this is actually a sizable project, and then you've got some matching, you've got some funds matching, which is really good. And then finally, just one little small comment I might make for the reviewers is to try and be as self-contained within the text of the grant, and not make it necessary for them to go to appendices and things like that. And one thing I find, and Neil, probably this in your world, I find the basic scientists do this really nicely. They'll stick, you know, a little graphic, you know, showing, you know, one biomarker versus another in a histogram with a statistical, you know, difference. And it also breaks up the text. So that's just a few little things. But overall, I think this is hopefully, for whoever catches this on tape, just an excellent workshop.
Okay, any questions from anybody? And feel free to ask anything. If you've had issues with the grant before, I feel like it's markedly changed now. So feel free to vent or bring up anything. Let the paranoid side out, or if there's any sort of practical issues. Anyone? Hello to both of you.
Can I ask yeah, sorry, my daughter joined you. This is great. Thanks, guys, for doing it. From your experience, and Graeme, maybe, and Ian, from the years that you've reviewed it, for people who are trying to get educational projects to fit into innovation funds. So I've been struggling this, I mean, for the last 6 years. The only thing I've had funded is some collaborative work that we've done with computing. I guess several years ago, but I kind of struggle with this idea of, you know, a clinical problem, the educational piece, and the way that you want to teach someone to solve a clinical problem. Have you had, like, when people are successful, how do they how do you spin it in a way to make it fit? Because the grant itself is a significant amount of money to do good work, but I sometimes have a hard time making that connection between the education, the clinical need, and really improving the healthcare of the patients.
Yeah, good question. So I've actually only been involved with the Innovation Fund, at least from an organizational point of view, for the last year. I did review grants like for the iterations for a number of years, but I was really brought on board to help to kind of rejig the system. Education is not penalized, or educational research is not penalized, but it's probably a little bit harder to sell in terms of it's more kind of qualitative than quantitative research, and that doesn't make it wrong. And you can have a good qualitative study that's as good, if not better, than a quantitative study. So I think it probably just takes more to educate the reviewers, because most of the reviewers are not going to be qualitative researchers. They're going to be quantitative researchers. So you're going to have to ensure that they really understand how this is going to change what we do. Now, if you put in a grant to say, we want to set up and run a point of care ultrasound, I'm just picking a topic. I'm not saying that this is right or wrong, but let's say you wanted to set up a point of care ultrasound in general surgery, whatever. Is it a really research project, or is it a clinical implementation type study? So again, you have to be very clear on what it is, but I think the hard part is that you need to make the reviewers understand. And we've certainly funded educational studies in the past. We haven't got a lot, is my recollection, and I can't remember how many we had in the last iteration of the competition. But I think you just have to make sure that you do a really good job explaining it so people understand it.
Thanks.
Yeah. Oh, sorry. I was going to say, this is it's kind of tricky, actually. I see where you're coming from. So if we went back through this, it would be, what is the innovation here? So that's where you have to show that there's a departure from what's currently going on. It also has to have an impact that works in the healthcare system and changes that. So I think if you've got that under control and it's clear, then it's probably a good place for it. If not, you might be in the wrong grant competition. I mean, that's another possibility, and it should be a medical education grant. But I think you have to write it really clearly for the reviewer to show the innovation. So go back and check what the Innovation Fund actually does allow, and then make sure you're sort of properly positioned, I'd say.
Thank you.
Any other questions? That was a tough question, actually. That was super good. Any other questions?
Yeah, I have a question. Thanks, everyone. I came a little late. I'm still in clinic, so I'm just sort of juggling a few things. But I wondered and I just want to say too, Neil, I really appreciate some of the insights, because it helped me with my last innovation grant submission, really understand some of the reviewers' comments. Okay. The limitations section, I really struggle with. I think I write something really weak that doesn't really, like, I sort of pick a weakness to a grant that doesn't really apply. I'm curious for people who have experience with reading grants, because to me it seems sort of obvious what some of the major weaknesses are that I don't address, and sometimes the reviewers catch them. Sometimes they pick something else, right, which is really helpful. But when those of you who read grants often, do you feel like you're reading cop-out kind of limitations that people are picking? Should I really be picking these things that really I worry I'm sinking my own grant when I write? I remember writing the innovation grant thinking this is going to be the end of it, right? No one's going to want to read it after this. What do you guys think?
I'll hand that over to Graeme and Ian. and Don is there too.
Sorry, say again.
Yeah, sorry, could you repeat the question?
Yeah, sorry. So when you write a limitation section, would you suggest really identifying some major weaknesses in your grant that maybe could be addressed in some other grant, or should you stick with something that's a little more straightforward that maybe
I think honesty is always the best policy. I think if you haven't identified it, but a reviewer, identifies it, they are going to zoom in on it and you are sunk. So I think it's fair to bring it up. I think you're going to have to respond to that limitation in terms of either how you're going to get around it in this grant, or based on these results in a future study. One limitation might be, do we have enough sample size? And typically what happens, like if you're putting in an RCT grant or a cohort study grant, it might be, we're going to review recruitment after 6 or 12 months, and if this doesn't, if we're not at where we want to be, people in Ottawa are going to participate, that kind of thing. So identify, I would certainly identify the major issues, but just think of how you're going to fix those issues or respond to them. Because as I say, if you've thought of them, I can guarantee you a really good reviewer is going to pick them out as well.
Yeah, I got to say, I fully agree with that. That honesty is the best policy. And, the reviewers, they've probably written a lot of grants themselves and they know every trick in the book, right? So you might as well just fess up. If it's a major weakness, should you have written the grant in the first place, right? So maybe you have to have a little bit of a rethink on that. But I feel like, yeah, if there's going to be a problem, it's okay that there are problems on grants, but there has to be some sort of mitigation strategy to get around it. And as long as that's good and clear, then I don't think it's a problem to bring up. I did say don't shoot yourself in the foot. So you can, of course, use language that sort of makes it look a little less than, awful, right? But you should bring it up. Yep.
Yeah, like if you said, we want to answer the question, we're going to have to recruit 1,000 people in the first year, and we just can't do that. I mean, you've shot yourself in the foot. But if you say, we're going to recruit 100 people as a pilot study, and we can do that and use that data, to justify a larger grant to CIHR or heart and stroke or whatever, that I think is fair. So you could identify a weakness saying, we don't have enough sample size to do the be all and end all study, but the goal is to do the pilot study to collect data to, subsequently do a power calculation, whatnot.
Can I ask what the major weakness was?
So for my grant, it was really that I didn't have any experience with one of the techniques, and I wasn't able to demonstrate beyond one set of experiments that we'd done it. It was brand new, and
yeah,
so and it was identified.
But is there somebody around who has that expertise?
Yeah, and so this was, and again, you know what it is? It's timing too, right? As I felt like, if I had another month, right, I would sort of meet with somebody, pitch my idea, get them a letter from them, which is what I would do like for CIHR level, and this is the challenge sometimes at the end of the day, you just run out of time.
Yeah, for sure. Yeah. Anyway, it sounds like there's a very good mitigation strategy. So yeah.
Thank you.
Let's see. So Genevieve and Don, did you have any thoughts you want to share? Any final words?
All I was going to add was what Neil had commented too, which is I think the power of really taking a collaborative approach to these grants. Like I learned a lot from him through the writing, and it sounds like he got something out of my clinical background and expertise. And so I know it does take a lot of time, but what I've learned is it's almost better before you even get into writing the grant, have those meetings up front, brainstorm those ideas early on, so things can be happening in parallel if you need to try and get a letter from somebody, or if you need to explore where you think there might be a problem, that can happen before you even started putting pen to paper on writing the grant. Because I think that's where the strength of the grant comes from, is when you start building on each other's expertise. So that's what I've learned from this grant process, and it's great because this is one of the first times that I think it's really been more of a collaborative, kind of like bringing two expertise together, whereas historically some of the grants I've written have been just me going after something from a quality improvement perspective, and I think this made it stronger in the end.
Yeah, I guess I had two last points. So one, it's a really, really important grant competition. So this is for the CMO representatives, and this is money that sort of gets you forward to like bigger competitions. So it's super important. If there's more money to put into it, that would be great. And then for Savula, I never would have found Genevieve if it hadn't been for a CMO communication. So these are super, super important too. So huge thanks to both of you for really helping us sort of get this together. I wouldn't have known. I would have been in an autopsy basement and had no clue what was going on campus. So much appreciated. Anyway, I think that's it. Unless anybody has any other comments. I'm seeing some.
Thanks to you both. It's been great.
Thanks, everybody.
You're very welcome. Thank you all.
Good job. Thank you.
Cheers.